Hi, I'm Dr. Mark Burhenne of AskTheDentist.com. So today I want to talk to you about a very important product. The product category is very important as well, and that is mouth tape. So a lot of you may not know what I'm talking about, but it's exactly what maybe you're thinking, and that is taping your mouth closed when you go to sleep, of course. You can tape during the day if you want, but that's not very practical. So anyway, this is the Rolls-Royce product in the category. It's called Somnifix. My wife is actually crazy about this product. It's about $20 a box. It gives you 28 pieces of mouth tape individually wrapped. You can reuse the tape. I think we can get about 3 to 5 uses out of each tape. So that gives you an idea of what it costs per night to tape. So why would you want to tape? What's the big deal about mouth taping? The reason you want to mouth tape is because you'll sleep better and you'll produce more nitric oxide, and you may actually be able to balance the pH of your blood better. So breathing is very important, certainly during the day while you're awake, but certainly at night. You need to have your mouth closed. Now, there are some dental benefits to having your mouth closed at night. If you mouth breathe all night long, or even part of the night, you're going to get a dry mouth, you're going to get more cavities, you're going to get more gum disease, and you're going to probably get some bad breath. A dry mouth is not a optimal condition for the inside of the mouth, the intraoral parts of the mouth. So anyway, so Somnifix, or mouth taping, is a great way to solve those problems. I know that I'm very worried about getting gum disease because of the implications of gum disease. And if I can fix it quickly by just putting some tape on at night, I will do it. And I tape every single night. I sleep better, I feel better if I tape. So anyway, so there's some tidbits on mouth taping, why you should mouth tape. I would recommend using this product first because, and this is the purpose of the video, is that surgical tape, which is the product that I first recommended because this wasn't available. Surgical tape, don't use duct tape, please. Surgical tape is a little sticky, it's hard to peel off in the morning. You'll never suffocate in the middle of the night. The tape comes off with a struggle, perhaps, but it will come off. But you know, I have short beard hairs here, that hurts. Sometimes I pull off some skin. If I have chapped lips, I'll pull off a piece and I'm sore all day long. That won't happen with this tape. This tape is a lot more kind to your sensitive lip tissues, and it also has a little vent in it. So just in case you get a little nervous, there is a vent, and that gives a lot of security to a lot of people that are a little nervous about mouth taping. And there are a lot of people that are nervous about mouth taping. But I encourage you to try mouth taping. You'll feel the difference. Give it 10 days. Most people feel the difference the next morning. Try it. See if you like it. And I would recommend starting off with this because it's the most comfortable, least threatening, just the warm fuzzy of all mouth tapes out there. So in this video, I want to just open the box and show you what it's like to mouth tape. This does have FDA approval for adults. I actually recommend it for children in my practice, but I show them how to do it, and we can do vertical taping with surgical tape. There are lots of options. There's a great little booklet in here that I encourage you to read. I believe it's available online as well, the information. People that wear CPAPs, oral appliances, people that have sleep apnea can wear this. You know, the old standby was the chin strap, which was a great thing to use. But even if you don't think you snore, even if you're perfectly healthy, young, try mouth taping to see what the effect is. If you wake up with a dry mouth in the morning, you should definitely be trying mouth tape. So there's a little groove on one side of the package. There it is. You tear that down and out. You pull the mouth tape out. So, okay. There's a little vent. You can see the vent. There's a smooth side and a rough side. And like a decal, you have to kind of pull them apart. There it is. Okay. And there's a sticky side. It's got great adhesive. It's soft. It's slightly elastic. Because I have some facial hair, I have to pucker up a little bit and kind of catch the fleshy part of the lips. Everyone's a little different, but I would use a very relaxed posture of the lips so that you're not held in a place all night long in a non-relaxed position. So make sure you're comfortable with the position of your lips before you stick this on there. So I'm just going to kind of relax, close my lips, and maybe just pucker out a little bit. So again, that's because I have facial hair. So here we go. Comes off if you need to in the middle of the night. And this is a great test for you as well. I use it as a differential diagnosis. In my practice, what that means is that if I have the patient accept the whole idea of mouth taping, and if it keeps coming off at night, I know that they have an issue with nose breathing, and then I give a referral to an ENT, and that problem gets fixed. If it stays on and they're happy, that's a great thing too, and that reassures me, especially when I'm treating someone with sleep apnea, that they can breathe through their nose. So anyway, I can reuse it. That's how you mouth tape. It's easy. It should be fun. I'd recommend everyone, your partner, everyone, try mouth taping. See what happens. You have nothing to lose except a really good night's sleep and a good day the next day. So try Somnifix. So I just peeled it off instead of popping my lips open. Another reason this tape is so great, that when I use surgical tape, I have this funny taste, probably a few hours in the morning. And also, as I told you before, I pull off some skin sometimes. But this doesn't leave any residue, and it's still sticky. Usually what my wife and I do, we just leave it at the edge of our bed like that, at the edge of our night table, and it's there the next evening, easily picked up again and reused. So again, this is the Rolls Royce of mouth tape. If you're interested in mouth taping, go right to this. Don't play around with surgical tape like I've been using for a while, because it's a pain in the neck. And I want your first experience of mouth taping to be a good one. So because I really like this tape and I want people to try it, and I want people to try it at least for 10 days, I reached out to the company and I was able to get the viewers of this video a discount on buying their first box. So look in the description below and you'll see that there's a discount code for saving some money on your first order of Somnifix. If you want to hear more about mouth taping, which we are always talking about, subscribe to this YouTube channel, and you'll get a lot more information about mouth taping. Again, thanks for watching this video. If you have more questions about this, I'd love to hear about what you think of mouth taping. It's one of my favorite subjects, but I like hearing what the reactions are and why maybe you wouldn't want a mouth tape, because I have an answer for you. You should try mouth taping. Thanks for watching this video.